Welcome to another session of Inside Washington Hospital. I'm your host, Dr. John Thomas Mahegan. Heart disease is the leading cause of death in the United States, and the same is true for Alameda County. All of us who are part of the Washington Hospital team are committed to providing our community with the best possible cardiac care, from leading-edge diagnostic procedures and interventional services to the latest in surgical techniques. Today, we'll take an inside look at two different but equally important aspects of cardiac treatment at Washington Hospital: Dr. Ash Jain's superb cardiac emergency response team and our highly acclaimed cardiac surgery team led by Dr. John Cecil Walks. And you'll be able to see firsthand why Washington Hospital is acclaimed as the most comprehensive and advanced heart program in the area. Let's look at what happens in an emergency situation. It's a time when having a highly efficient, well-trained team of experts can be the difference between life and death. This is a reenactment.
Andy, it looks like you may be having another heart attack. Okay, so we're going to transmit this picture to the doctor so they can take a look at it right away, and we're going to take you right over to Washington Hospital.
I don't think so anybody here is thinking negatively. Everybody is thinking that the patient needs to survive this event so that he can live another day.
Good afternoon, Washington. This is Medic 1 coming in code 3 to STEMI activation of a 64-year-old male complaining of chest pain for the past 20 minutes.
Pulsing at 110, breathing at 20, setting at 98% on high flow 2.
Ambulances in this area are capable of performing 12-lead EKGs, and when they get these EKGs, the machines actually interpret them for them. They can actually fax those EKGs into our emergency room. In fact, we have a machine here in our cath lab that actually will alarm with that EKG, and we can see the EKG before the patients ever come to the hospital. So we actually know not only that it's a real heart attack that's happening, but what area of the heart is being damaged.
This looks like a STEMI. Who's on call for cardiology?
Dr. Jain.
Can you get them right away? And call the cath lab and tell them that we've got a case that needs to come over right now.
When that fax is received and interpreted in the emergency department, a code STEMI is activated. Immediately, the call goes out to Washington's code STEMI team, who will respond within 30 minutes or less. The acronym stands for ST segment elevation myocardial infarction. Myocardial infarction is the clinical term for a heart attack. In an emergency situation, the best course of action is often a procedure called coronary angioplasty. The process involves the use of a catheter to insert and inflate a tiny balloon at the point in the heart where the artery is clogged. The procedure is often combined with the placement of a small metal coil, called a stent, in the clogged artery to help prop the artery open. The current American Heart Association guidelines recommend a door-to-balloon time of 90 minutes or less. This is the time between a patient's arrival at the hospital to the time the blockage in his artery is opened by the balloon. Last year, Washington Hospital's code STEMI team averaged 68 minutes per procedure.
They're hanging by a thread, but they're still awake, talking to you, telling you how they're feeling.
64-year-old male, acute onset substernal chest pain approximately 20 minutes ago, extensive cardiac history. We saw elevation in leads of
That means when they come wheeling with the paramedics, they get another EKG to verify that the patient is having a heart attack. When we get the call that the patient is out in the field with the ambulance, they will call us then.
You kind of get that immediate adrenaline rush because you know that something's going on, so then you head in and get prepared.
What's your pain right now between 0 and 10? 0's no pain, 10's the worst?
About 8.
Okay, and where is your pain?
Right.
We are on call for a 24-hour period, on the weekends 48 hours. We have to be within 30 minutes of the hospital at all times to respond to those STEMIs.
Washington Hospital is designated as a cardiac receiving center. With the most comprehensive heart program in the area, the hospital averages 10 code STEMIs a month.
The ER gets activated, so there are physicians there are lab techs, there are EKG techs, a whole bunch of people get involved. And this is done within a few minutes, within 5 to 10 minutes. And you could understand that when you involve that many people, each one needs to know their role. Each one needs to know where they fit in so that they can work as a team.
Hi. I'm Linda, and this is Lori. We're from the cath lab. We're nurses over there. We're going to take you over. Have you been there before?
Yes.
So you kind of have an idea of the procedure?
Yes.
Did Dr. Reddy explain everything to you?
Yes.
Okay. We're going to move kind of quickly now, okay, because we want to get you over there so that we can We want to relieve your pain. We want to stop any damage to your heart muscle. Okay?
I will go to the ER and pick up the patient and get a quick report on the patient, understand why they're here, what happened to them, how long they've been having symptoms, pick them up, bring them to the cath lab and take over their care.
Just it's focused. It's what is the patient looking like? What are we going to do about it? Getting them ready for the procedure, knowing that the sooner we get started, the better off for the patient it is.
With the room set up, the cath lab team, led by Dr. Jane, takes over. Door-to-balloon time is ticking while the patient is placed on the table. Monitoring equipment and IVs are hooked up. Brian Kring is the senior radiology technologist and the lead assistant. He's been with the unit for 8 years.
And just to get you draped up here. We expect things to kind of go a certain way because we do it so much, and you expect that it's kind of a routine. And when things fall out of that routine, which can happen because these are emergencies, that's what's most fearful about working here.
The fluoroscopy machine is moved into place. This allows the physician to obtain real-time moving images of the internal structure of the patient's heart. An introducer is put into place to create a pathway to the artery. Catheters are then advanced to the heart. For this diagnostic procedure, Dr. Jane gets access to the femoral artery, injects a dye, and then locates the blockage. More images are taken while the team cares for the patient who is conscious but in a twilight state.
That entails assessing the patient's condition at all times, being fully aware of what's going on with the patient, assessing their vital signs, giving them medications as needed. It's my job to make the doctor aware of what's going on with the patient. If the patient stops breathing, it's my job to say, hey doc, they're not breathing.
Blood pressure is dropping at 70/40.
The blood pressure of the patient is dropping.
Hang up a dopamine drip.
In this reenactment, before the cardiologist can open the blockage with a balloon and stent, the team must treat the loss of blood pressure with a drug called dopamine.
Physicians, nurses, technicians, everybody involved know that it's life and death, and they have to give their best. A lot of it is mechanical. A nurse is supposed to give the medicines, watch the monitor. Technician is supposed to be on your right-hand side, help you with the procedure, just doing the work, because there's really no time to think when you're doing this.
The nurses share responsibilities and can easily exchange roles. A critical position is the nurse in the control room, adjacent to the cath lab itself.
When we're in the control area, we will document what the patient looked like coming in. What's their baseline? What did they look like when they came here?
From the moment they come into the room, every medication that's given and what time and how much and what the reason for that medicine was, how they respond to those medications, to every vital sign, to every piece of equipment.
In addition to that, we're monitoring the patient's vital signs because the nurse who's circulating in here can't always be looking at the monitor, although the physician's looking at the monitor, the tech's looking at the monitor, but they tend to focus on the picture. So the person outside is focusing on the vital signs, focusing on what's happening in the picture above.
Nitro IV? Yep. And the person at that monitor not only has to know that procedure inside and out, they have to understand the equipment. So it's kind of a coordinating position when you're at the monitor.
The patient is now stable and the blockage has been located. Dr. Jane inserts a wire with a collapsed balloon. Using the monitor, he puts the balloon in place and inflates the balloon to the proper pressure. The balloon breaks up the fatty deposits and opens the blood vessel. Then, a stent is inserted and deployed. Door-to-balloon time, 65 minutes.
And you can see the relief. It's an immediate relief, both on the face of the patient as well as their family members.
So Andy, things look good.
Okay.
Everything worked out fine. You were having a heart attack. We opened up the artery. It looks good now.
Okay.
All right. So you want to work with a team of people that are positive, that think in a positive way, and that is what you get at Washington.
Now, with due modesty, can you take some credit for this?
I think it is a teamwork again. It is not one person's show. None of this can be one person's show. It has to be done together. I think if you save one life, that keeps you going for a few weeks and months. Okay, because saving a life is not easy, as you know. You've been a surgeon, you worked, and you've taken almost a dead person from the ER to the OR and made that person live. That keeps you going. Yeah. Because very few people can do that.
in a code STEMI situation, they're close to death. That they may even feel that they're close to death. They have that immediate sensation that they're going to die. And you take them from that to smiling at you saying they've never felt better, thank you so much, and you have a wife or a husband crying, thanking you so much. So it's nothing like it. It's immediate reward.
We know we had an integral part in what happened with them. And had we not had the cath lab here at Washington Hospital, you know, they wouldn't have gotten that kind of care.
When we come back, we're going to take a close look at the dedicated and talented people who make up our acclaimed heart surgery team here at Washington Hospital. If you should ever feel like you might be having a heart attack, time is critical. The most common heart attack warning signs are chest discomfort, discomfort in other areas of the upper body, shortness of breath, and sometimes breaking out in a cold sweat with nausea or lightheadedness. If you're feeling symptoms like these, don't drive yourself to the hospital. Call 911 immediately. It could save your life. Welcome back to Inside Washington Hospital, Advances in Cardiac Care. Washington Hospital has been a leader in the surgical intervention and treatment of adult heart disease for over 2 decades. The cardiac surgery program focuses on a multidisciplinary approach to providing care for our patients. One of the most common treatments the heart team performs is coronary bypass surgery, a procedure that restores the blood flow to the heart muscle by diverting the flow of blood around a section of blocked artery in the heart. The surgery is done by taking a healthy blood vessel from a leg, arm, chest, or abdomen and connecting it to the other arteries of the heart so that blood is bypassed around the diseased or blocked area. After coronary bypass surgery, normal blood flow is restored. The team is headed by Dr. John Cecil Walks, Washington Hospital's Medical Director of Cardiothoracic Surgery.
If you look at a lot of the other services like vascular surgery that you head up, or general surgery, orthopedic surgery, everybody in the community knows that Washington Hospital is the best at it. So, you know, what I want to do is hopefully bring cardiac surgery to that same level, and that's what drives me.
Dr. Walks is a great leader. I have worked with a couple of surgeons, lots of big personalities, and he's very easy to talk with, which goes a long way. In a team, you need to have a lot of communication so that you're all on the same page and you're working for the same goal.
It's a treat to work with a surgeon like Dr. Walks, who you always have a sense that he's in control, that he has an intense knowledge of the patient that he's working on at the moment, that he's familiar with their history, he knows what his plan is, he knows what he's going to do if there's a problem.
When I have something to say to him, he listens and he gives me his response, and then it's all in the interest of the patient.
He has his problem pathways all mapped out and laid out and ready. The staff in the room knows what he's going to need if something goes the wrong way, and everybody's prepared.
What do you see on a day-to-day basis that makes you happy to get up in the morning and come over here?
You know, the little things patients do for you, the look in patients' faces when they tell you how much they appreciate the job you've done for their loved one. That's probably the most important thing that I get on a daily basis, and that's what keeps me going.
From the beginning, what got Dr. Walks started and interested in the science and anatomy of the heart traces back to Port Arthur, Texas, where his father, Dr. Cecil Walks, is a family practitioner.
When I was in the 7th grade, my dad helped me build this artificial heart for a school project, and I actually won first place.
7th grade?
That's right, in the 7th grade. We made a mold of a heart, and I had a little pump from an aquarium store, and the blood would pump through the heart, and I must say I was kind of hooked after that.
Well, here we're in the operating room that you command every day. Tell us about your team.
I would say that at any given time when you're in the operating room to do cardiac surgery, there are at least 8 or 10 people there. It starts with an anesthesia doctor who puts you to sleep and is probably your best friend as you kind of come into the operating room and you're nervous, and they give you the drugs that make you really relaxed and put you to sleep.
The role of the anesthesiologist is to defend the patient and facilitate the surgery. The patient has been rendered defenseless, so our job is to defend the patient and be vigilant at all times in the environment that they're in. So our deal is that we will shepherd you through this process. while the surgeon fixes you. And so we spend a lot of time in both a close dialogue with the surgeon, but also very directly manipulating the patient's blood pressure, his heart rates, using powerful drugs to both raise and lower blood pressure or raise and lower heart rate, pacemaking, and then also a very direct communication with the surgeon at all times to make sure that the surgeon is aware of how the patient is doing while this is happening.
Amy Robertson is Washington Hospital's Cardiothoracic and Vascular Services Coordinator and a surgical scrub technician.
We all have the same mentality, so when we come to work every morning, we're all on the same page. We're here to support our surgeons to the best of our abilities, which are quite great, and we're here to advocate for patient safety and outcome. I think our program is not only excellent but honest. Every nurse or surgeon or physician who steps inside our cardiac program has an amazing surgical conscience, which means that we will do everything to the best of our ability, no matter what, to make our patients 100% safe.
As a perfusionist, I run the heart-lung machine, or cardiopulmonary bypass machine, in open heart surgery procedures, so coronary artery surgery, valve replacements, valve repair here at Washington Hospital. The heart-lung machine takes over the function of a patient's heart and lungs during a procedure that allows the surgeon to work in a motionless and bloodless field.
There are only 4,000 certified perfusionists in the United States, and Aaron is one of 2 at Washington Hospital. For on-pump procedures, the patient's heart is safely stopped, providing easier visibility and potentially better grafting.
The machine takes over the function of pumping blood throughout their body. We have an oxygenator that is incorporated into the machine that oxygenates and also maintains the temperature of the patient's blood while they're on the cardiopulmonary bypass machine.
Yeah, we're there. Integrate's off. Okay, retrograde. Running retro. Sump on. Sump on.
At the end of the procedure, the heart is restarted. We wean the patient off the machine, completely disconnect them, allowing them to take over the responsibility of pumping blood through the heart and lungs themselves. More or less, when you're on bypass, you have a patient's life in your hands. And so you must be 100% certain that every decision you make is the right one for that patient on that day.
Darcy Alley has been working at Washington Hospital for 10 years. She has scrubbed with the heart program since the age of 21.
I constantly am focusing on the patient, what's best for them. Sometimes we get a little wrapped up in the right instrument to hand, or what the doctor wants, kind of our focus as a job, and I think it's just challenging at times, but very important, and definitely my main focus to try and remember, is this what's best for the patient? Is this what the patient would want if they were able to tell me? I knew that this was the place for me. It just gave me such a great sense of accomplishment. I really feel very proud of myself. I know that I'm helping people. It makes me feel very good about what I do. I love to tell people about what I do, that I'm an OR nurse, and yeah, I'm very proud. That it means a lot to me.
Robert Hsu is a physician assistant at Washington Hospital. He is licensed to practice medicine with the supervision of a physician and provides a broad range of services.
Okay, so I'm just going to take a listen to your heart. Just breathe normally. As a PA in cardiac surgery, I'm able to see patients in the preoperative setting, do histories and physicals on patients, and then I see them in the operating room. I assist in surgery. In the ICU, I take care of them in the ICU, as well as take care of them on the floor, and then see them as a postoperative patient. Now, during the procedure, the surgeon is going to be usually harvesting the left internal mammary artery for use as a conduit, but that only provides you one bypass. So we need to go and find other veins or arteries for use in the bypass, and that's where one of my jobs is to harvest the vein from the lower leg or arteries from the arms. The particular way that I do it is a technique called endoscopic vein harvest. Now, in that procedure, we're able to make very small incisions to be able to take out a large length of vein for use during bypass. I think everybody in our team works very well together. Particularly, you notice when there are stressful times that everybody works so well together. That's really the measure of whether or not you have a good team.
As I always tell people, you can do a great operation, and if you don't have the people that are there helping you do it and helping you in the aftercare of your patients, who strive to make everything go perfectly and for the patient to have a great experience, you won't have a good outcome. So that's what we try to do here at Washington Hospital. I mean, our goal is to take care of patients like they're one of our family members and give them a good operation at the same time. No man is an island, and you can't do this by yourself, and none of the success that we have here would be possible without the great team that we have.
Washington Hospital is recognized as a leading regional center for cardiac care. As we have seen, it is the dedicated, highly skilled, compassionate people who are able to work together smoothly and efficiently as a team, even under extreme pressure, who are largely responsible for that reputation. So, whether you should be so unfortunate as to suffer a heart attack and need emergency treatment, or you're facing the possibility of heart surgery, you can be confident that you'll be in good hands at Washington Hospital. I'm John Thomas Mahegan. Thanks for watching Inside Washington Hospital.